Welcome. This is Jean Eaton of Information Managers. It's my pleasure to be with you today. Today we're going to talk just a little bit about what is a privacy impact assessment. Is a privacy impact assessment? Who needs to have a privacy impact assessment completed? And how do you determine if you already have one? So a privacy impact assessment is done by all businesses whenever you collect, use, and disclose personal information. So personal information might be of clients. It might be of business partners. It might be of the business itself and your employees. If you are providing a health service, it may be the personal information about the patients that you have in your practice. Who needs to have a privacy impact assessment completed? If you are a business owner, you collect, use, and disclose sensitive information about others or perhaps within your own practice about your employees and your business, then you need to complete a privacy impact assessment. Depending on the type of industry that you practice in, you might need to document and submit that privacy impact assessment for review or not. But it's always a good practice to have a privacy impact assessment. You want to make sure that you have good office practices and policies and that they are in writing so your staff know what the expectation is. Not only that, you want to be able to make sure that you can provide confidence to your clients and your business partners that you understand that their personal information is important and that they understand what you are doing to make sure that it's being managed and used in the way that it was intended to be done. A privacy impact assessment is needed any time that you collect, use, and disclose personal information. If you're going to share personal information with another organization, again, that's a good key requirement for having a privacy impact assessment. So a privacy impact assessment in Alberta is a requirement under the Health Information Act if you collect, use, and disclose information about patients when you provide a health service. So the health information is specific to the healthcare industry in Alberta. Many other provinces in Canada have similar legislation. The terminology might be a little bit different, but most Canadian provinces do require a privacy impact assessment to be completed if you are managing personal information about patients. Now, not all provinces require that information to be submitted for review. Alberta does. So, a Health Information Act requires anybody who is a custodian, and that is a specific type of individual, a profession that has been named under the Alberta Health Professions Act and has also been named under the Health Information Act, to submit a privacy impact assessment to the Office of the Information and Privacy Commissioner. So let's go back just a moment. Who are custodians? Well, custodians under the Health Information Act have been changed under significant amendments to the Health Information Act in 2010 and 2013. However, generally speaking, a custodian under the Act includes Alberta Health Services, or the Health Region Authority, Alberta Health and Wellness, or more specifically, the Minister of Health, physicians, pharmacists, pharmacy licensees and licensed pharmacies. It also now includes chiropractors, dental surgeons, dental mechanics, midwives, opticians, optometrists, podiatrists, and osteopaths. It also includes dentists and dental hygienists as of September 2011, and registered nurses as of September 2011. The Health Quality Council in 2012, and most recently, family care clinics have been identified as custodians under the Act in September of 2013. So if you are a custodian, if you are professional in any of those categories, and you are the owner of a business or collect, use, and disclose personal information, then you likely need to submit your privacy impact assessment to the Office of the Information and Privacy Commissioner, the OIPC. The OIPC is an agent of the Legislative Assembly in Alberta, which means that they're nonpartisan. is not part of the government department, and they are the advocates for individuals in Alberta. If you have a concern about how your information is being used, how it's being disclosed, or how it's being collected, you can inquire with the OIPC and, if necessary, make a complaint. So a healthcare organization, somebody who's providing a health service that includes custodians, needs to submit a privacy impact assessment to the Office of the Information and Privacy Commissioner. So what do you do if you're not sure if your organization has a privacy impact assessment? You can go to the Commissioner's website, oipc.ab.ca, and look under the PIA registry. You look by the custodian's last name. So if you worked for a doctor, Dr. XYZ, you would type in Dr. XYZ in the search button in the registry. Now, if you can't find your custodian's name on the PIA registry, it doesn't necessarily mean that they haven't done a PIA. It just means that you can't find it on the website. So if that's you, if you're not sure if you have a privacy impact assessment and you can't find it on the website, contact the Commissioner's office. If you go onto the website, oipc.ab.ca, you'll see the Contact Us information, and you can find the Commissioner's information there and make that request. For more information about privacy impact assessments, please visit our website, informationmanagers.ca. This is Jean Eaton of Information Managers. Thank you for joining us.